Good afternoon, everyone. My name is Liz Deepers, and I'm hosting this webinar on behalf of Aracy. Thank you for joining us today. Before we begin, we'd like to acknowledge that we're meeting today on the unceded sovereign lands of Aboriginal people. We acknowledge the traditional custodians and their enduring connection to its lands, waters, and skies. I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples. In solidarity, Aracy supports the Uluru Statement from the Heart and the need for truth-telling and about the history and impact of colonisation. We treasure the rich and diverse cultures and customs of First Nations people. We value the knowledge holders, leaders, and partners in creating conditions for all our children to thrive. Please acknowledge the country you're joining us from today in the chat. So it's my pleasure to be joined today by three incredible and passionate professionals to discuss the work of the Australian Homelessness Cohort Consortium and their population-based longitudinal studies and how this work can and must influence policy and practice to improve outcomes for young homeless people. Firstly, we'll hear from Associate Professor Jess Heerde, National Health and Medical Research Council Emerging Leadership Fellow at the University of Melbourne. Based at the Centre for Adolescent Health, Jess runs a multidisciplinary research program on the health of Australia's homeless children and adolescents. Funded by NHMRC Investigator Grant, Jess is examining risk and protective factors that define pathways to and out of homelessness, as well as assessing health and mortality following contact with the homeless service system in Australia. Jess is also leading the development of the Australian Homeless Cohort Consortium. And following Jess, we'll hear from Kate Colvin, CEO of Homelessness Australia. Prior to joining Homelessness Australia 2 years ago, Kate was the Deputy CEO at the Victorian Peak Body for Homelessness, Council to Homeless Persons, and spokesperson for the National Housing and Homelessness campaign, Everybody's Home. Kate in senior leadership roles in youth policy, youth justice, housing, and broader welfare and social. Joining Jess and Kate for our panel discussion is Susan Sawyer. A paediatrician by training, Susan has helped develop the field of adolescent health, both nationally and internationally. She was instrumental in the work that established the accreditation of adolescent and young adult medicine as a specialist field of medical practice in Australia. Susan holds the inaugural chair of Adolescent Health Department of Paediatrics, the University of Melbourne, and is director of the Centre for Adolescent Health at the Royal Children's Hospital, a WHO collaborating Centre for Adolescent Health. Susan is the immediate past president of the International Association for Adolescent Health. So what wonderful speakers we have joining us today, and now it's my pleasure to hand over to Jess Heerde.
Thank you, Liz, and I will just share my screen. I'm hoping everyone can see that.
We've got that, Jess.
Got that, great. So good afternoon, everyone. It's lovely to be here today, and thank you to Aracy and the Life Course Longitudinal Studies Collaborative for the invitation to speak today. And also thank you to Kate and Susan for joining me in this webinar today. I'm really glad you could both make it. So as you've just heard, my name is Jess Heerde, and I'm an associate professor at the University of Melbourne and the Centre for Adolescent Health. And today I'll be speaking about the work I lead on the health of Australia's homeless children and adolescents. Before I go on, I would also like to acknowledge the traditional custodians of the land on which we're meeting today. I am on the lands of the Wurundjeri people of the Kulin Nation, and I acknowledge and pay my respects to their elders past, present, and emerging. Now, I always like to include this slide within my presentations to recognise that some people who are joining us live today, some people in the sector, some people in the community, some people who are watching the recording of this webinar may have experienced homelessness or trauma or other related hardships. I would also like to recognise that, there are children and adolescents who are at risk of homelessness at the moment, who are currently experiencing homelessness or have experienced homelessness and are dealing with the many long-term impacts that come from that. And I also want to remember, without any shame or stigma, the children and adolescents who have died as a result of their homelessness, and acknowledge the grief of friends and associates and colleagues who are left behind. I do want to say that today this presentation will not go into any detail about lived experience, but that in itself doesn't mean that people won't think about their experiences because of this subject matter. So I do want to encourage anyone who feels like they need to take a break during this presentation to do so, and to reach out to any of these support services on your journey should you feel the need to do that. So as Liz mentioned, I lead a multidisciplinary program on the health of Australia's homeless children and adolescents. It is funded by the NHMRC, and it is looking, I guess, at two specific areas of work. One, the pathways that, I guess, define young people's homelessness. How do they get into homelessness? How might they get out of homelessness? And that is the focus of this presentation. And then secondly, not so much a focus for today, but still a very important aspect of the work I do, looking at the health and mortality of children and adolescents following their contact with the homelessness service system. And this is a national data linkage study. So in my work, I combine a lived experience perspective with health and psychology training and a population health approach. And I use those approaches to identify and to intervene on the social determinants and processes within the context that children and adolescents live. And we do this, I guess, to build the knowledge and the tools that we need to support children and adolescents, shape the environments, the social conditions they live in, their relationships they have, and the prevention and intervention efforts that we can use to target this risk at the earliest point in the life course. So today I'll be speaking about, firstly, what we currently understand about social determinants of homelessness for children and adolescents. Secondly, what we don't know about social determinants, and I guess the reason we have established the Australian Homelessness Cohort Consortium. And thirdly, how we can better inform health and social policy. And I'm really excited to hear from Kate more on how we might be able, to do that. So the goal for today is to provide some overarching information on the recent evidence that we've built, introduce you to the consortium, and, in summary, provide some points to consider in the discussion that we might have today and beyond today on homelessness prevention across the life course. So what are we covering today? I'll briefly, I think we've already done that. I'm sorry for that, a slide mix-up. But basically today, I want to look at what we know, what we don't know, and then where we are going. So let's start by briefly looking at access of homelessness services across age groups. Now, this data comes directly from the Australian Institute of Health and Welfare data cubes, which give us a whole range of information about clients who are accessing specialist homelessness services. And what we can see here is that rates of service use and access are unacceptably constant. And, to be frank, they have been since 2014. So it should be, and it is of concern to us, that over 40,000 children and adolescents have presented as clients to SHS annually from 2014 through to 2022 because of inadequate housing or homelessness, having no housing at all. But having said that, we also need to consider that, the broader predicament of insecure housing is also relevant for children and adolescents in these age groups, which means that these numbers likely underestimate the size of the problem we have. Many children and adolescents are not yet known to services. So when we think about these numbers, when we think about the predicament that, children and young people are in, what can we do about it? So I want to talk a little bit now about population risk. This is a key idea underpinning my research program and the consortium that we've established. And the idea is that we can intervene on risk and protective processes or social determinants within the various contexts and environments children and adolescents interact. And by doing this, we can support the health and well-being of all children and adolescents, as well as those who are at high risk of homelessness. And we do this by trying to shift population risk. So as you can see in this graph here, the group in red are the children and adolescents in the population who are considered to be at high risk. Now, if we intervene only with this group, we can shift them to a more normal range. That is, we can decrease the risk that they're facing. And this is where most of our current efforts to reduce homelessness among children and adolescents sit. This is a targeted strategy, and although it does have an impact, that impact is really only for the number of individuals that it targets. If we move to shifting to a population risk approach, or that is a public health approach, we start to think about how we can prevent homelessness. So as you can see in the lime green here, by using this approach, we aim to shift the entire population to the left of this graph. So from a normal risk range to a lower risk range. And this is a universal approach, so it benefits a large number of children and adolescents, as well as those children and adolescents who are considered to be at high risk. And the work we've been doing that informed the development of the consortium is built on this approach. So an approach where we support all children and adolescents, regardless of their risk status, with a focus on the general population. So I want to briefly recap now, as a sector, as, many people working with children and adolescents, what we know about child and adolescent homelessness. We know that developmentally, childhood and adolescence are times of profound physical, emotional, and social change, especially through puberty and into the adolescent years. And we know that growth and development at these stages set a foundation for healthy development. But experiencing homelessness at this time places children and adolescents at increased risk for early death and for preventable multi-morbidities. So I think we can agree that, homelessness is influenced by a range of factors. As a group, as a community, we commonly discuss it in topics around poverty and income inequality, around unemployment and financial precarity, around family and domestic violence, around leaving care, around mental health, around substance misuse. And collectively, we accept that homelessness doesn't discriminate. We know that children and adolescents who experience homelessness include those who are unaccompanied and those who are accompanied. We know that some will have a history of out-of-home care placement, justice involvement, or have been discharged from hospital or institutional settings. Some of these children and adolescents are First Nations identifying. Others are infants and children born to adolescents who are experiencing homelessness. Some children and adolescents grow up within homeless families. Others are refugees or seeking asylum. Some of them are international students. Some children and adolescents have had stable upbringings, but have been affected by family circumstances, such as the death of a parent, while others have been forced out of the family home due to climate crises. So in summary, we know that homelessness doesn't discriminate. Children and adolescents come from a range of social and economic positions. They come from inner, middle, and outer suburbia, as well as rural areas. But importantly, they're often hidden from public view. And, collectively, we acknowledge that homelessness can be a one-off experience. It can be periodic or recurring, or it could be continuing. And this means that intervention, prevention, and post-intervention support is needed at all levels. So we need to cater for all young people. However, our current responses to child and adolescent homelessness are overwhelmingly downstream. So they're focused on that red group that I showed you in the previous slide. Now, as I mentioned at the beginning of this presentation, a core component of the work that I'm doing at the moment is understanding those factors that define pathways into and out of homelessness. And a first, step in exploring this component has been using data from our International Youth Development Study. I am a co-director of that study, and it's one of the studies that sits in the ARACI Longitudinal Studies Collaborative. It's a long-term study that looks at the development of healthy and problem behaviours among children and adolescents, both here in Victoria and in Washington State in the US. It began in 2002, and our latest data collection here in Victoria was in 2014. Originally, we included about 2,800 participants in Victoria, and they have been very consistently followed from age 10 to 2014 when they were about 28 years of age. So you can see in the light blue areas of this table, we've collected data on a range of risk and protective factors, as well as health and social outcomes, including homelessness, mental health, and substance use. Now, I think importantly, the IYDS was one of the first studies designed to examine whether or not differences in Australian policy and American policy affect youth development. And part of the work I've been doing in this study is examining how the incidence of homelessness and those factors that influence someone's pathway into homelessness might differ between these two settings. So I'm going to share with you now a few findings briefly from the work that we've been doing. If we first look at the diagram on the left of the screen, these two studies looked at, two different components of family risk, the way that family risk influenced risk within other settings young people interact, and then later homelessness. So if we first look at the diagram on the left, what we can see is that less positive family management strategies in early adolescence, so around age 13, such as lack of clear rules within the family environment or low parental monitoring, predicted several risk factors at age 15. Those risk factors included engaging with peers who were using substances, school suspension, academic failure, or, as I probably prefer to call it, academic underachievement, and lower neighbourhood attachment. And in turn, these risk factors predicted young adult homelessness at age 25. On the right, we have a second study which found that higher levels of family conflict at age 13 predicted increases in two risk factors when young people were aged 15. Again, engagement with peers who were using drugs or substances, and interactions with antisocial peers. And those two factors in turn predicted a greater likelihood of homelessness by age 25. So what is this saying to us? Well, overall, these findings suggest that these two types of family risk factors, so poor family management and family conflict, occurring in early adolescence, are important predictors of other risk factors in the adolescent years related to peer groups, related to school, and related to community, which in turn influenced the risk for homelessness in young adulthood. So across the various studies we've done, we've also seen some effects of school suspension in early and mid-adolescence on later homelessness. And we saw this in the models on the previous slide. We can also see in this study. So within the ROADS, we know that over half of the young adults who reported homelessness at age 25 also reported having been suspended from school. So what we wanted to do was look at various adolescent behaviours, the way they may relate to suspension, and then the way that that relates to later homelessness. So what we found was that suspension at age 15 predicted homelessness at age 25. What we can also see from this model is that higher levels of rebelliousness, engagement in types of antisocial behaviour, engagement in substance use predicted a higher likelihood that young people might be suspended from school. And those factors were also related to risk for later homelessness. So I guess overall what these findings suggest to us is that school suspension may well be an important risk factor for future homelessness, and that prevention efforts that seek to, mitigate some of these other risk factors like substance use or antisocial behaviours, and indeed school suspension, may help to reduce young adult homelessness over time. Now, the question that I find myself asking, and you're probably all asking yourselves now, is all of this information enough to conclude that we know what factors increase the likelihood of homelessness for children and adolescents? For me, the answer is no. No, we don't. And I think what we need to do is really look further into the range of processes within the conditions and the context that children and adolescents live that might increase or in fact decrease risk for homelessness. So by that, what we're really doing is wanting to look at these factors on the left of this diagram. What we have on the right of that diagram is, I guess, a whole lot of health consequences and conditions that may relate from homelessness. So if we can decrease the number of people who are entering homelessness, then we may well decrease the impact that homelessness has on people as well. So for example, if we can identify risk in family, school, community, and peer settings, then that in itself is an essential step to connecting adolescents who might be at higher risk of later homelessness with the most appropriate prevention programming and support. So that programming and that support, delivered prior to or during the early adolescent years and within a range of settings. And importantly, the timing of the risk and the timing of the prevention programming and support is really important in this process. And all of that has led us to having established the Australian Homelessness Cohort Consortium. So I guess in summary, what we have found and why we've developed this consortium is that we can say that it is possible to identify determinants of homelessness from early on in adolescence, and it's also possible to identify the interrelationships among those determinants, and the way that they operate at individual, family, peer, school, community, and at policy levels. But we still have many knowledge gaps. There's still a lot of work to do, and that is why we have established the Australian Homelessness Cohort Consortium. The consortium itself is situated within the ARACI Life Course Longitudinal Studies Collaborative. And I think, it presents an important opportunity for us to really, drill down and understand those pathways into homelessness, both within generations and across generations. So we'll bring together 4 long-running Australian cohort studies to really look at modifiable determinants of homelessness as children mature from childhood into adolescence and then into adulthood. And it will really allow us to investigate questions that relate to things like rates and patterns of homelessness across periods of development, and those determinants that place children and adolescents at increased risk of homelessness, or in turn reduced risk of homelessness. So the 4 cohorts that we're bringing together are the International Youth Development Study, which I spoke about earlier, the Child to Adulthood Transition Study, data from the Victorian Adolescent Health Cohort Study, and data from ATP, the Australian Temperament Project. And we've selected these studies for inclusion based on similarities across them in measures of social determinants and of homelessness, as well as similarities in assessment at different ages and stages of development from childhood and into adolescence. So we're really in the early phase of this consortium, what I would call the establishment phase, going through a lot of the administration and the organising of permissions around data access. And there's a lot to come in the next 12 months. But while all those administrative aspects are going on and are progressing, the first, project or task for us is a global review of the social determinants of homelessness from childhood to adolescence. It's going to be a big review. It's currently in its early stages. And I guess our hope is for the findings of this review to really serve as a guide for the analyses we undertake within the consortium. And, more practically, as a guide for informing health and social policy. And I think, this is an important first step for us, because much of the knowledge we have on pathways to homelessness at the moment is based on small, point in time or cross-sectional studies that have analysed data from adolescents, not necessarily from children, but those adolescents who are young people who are, already experiencing homelessness or at high risk. So what that means is those existing studies really haven't been able to look at factors that are associated with homelessness over time. They haven't been able to look at things like age or stage of child and adolescent development. And so, in this review, we're really looking at, how many studies are out there that have analysed data from population-based cohort studies, and what have they examined within those studies. So we want to look at, which modifiable determinants have been looked at in these studies that have placed children and adolescents at increased or decreased risk of homelessness. And in doing that, given the longitudinal nature of the studies, what we want to do is really try and sequence those social determinants across development, so that we can identify opportunities to intervene at different ages and different stages of development. And I guess, overall, the what we want to achieve and the focus of this review is really to bring our attention back to the context and the conditions that influence pathways to homelessness, and those contexts and those conditions which might compromise growth and development for children and adolescents. And importantly, we do intend to maintain this as a living review, so that everyone has access to the most recent evidence on pathways to homelessness. You can use that in practice settings. We can use that around policy development or policy reform. It's important, that is a resource that's available to all. So onto policy, and just before I throw to Kate, what we intend to do with this consortium is really build an evidence base that can drive policy. That might be policy development, as I said, or that might be policy change. And in doing so, I think it's important, to kind of have a look at what has been done. And this slide here really is a summary of the different inquiries and reports that have been produced at the Commonwealth level relating to homelessness over the last 40 years. And you can see the two bold boxes on the left there are focused on children, on adolescents, predominantly adolescents, not so much children. And I think that's an important point because we know that childhood and adolescence are life phases that really underpin many state and federal agendas. And the reason for this is because investments at that time can support healthy trajectories across the life course. But if we think about that in terms of homelessness, I think what we can really confidently say is that homelessness in children and adolescents is a long neglected area of policy. And I think that really comes out in this figure, in that we haven't really had a specific policy inquiry or action relating to child and adolescent homelessness since the mid-1990s. Which I guess, underpins the fact that, recently we've seen many calls for the proposed National Housing and Homelessness Plan, expected this year to provide an agenda for national and state action on child and adolescent homelessness. And I think we're seeing that because, to date, we're yet to have a national agenda that encompasses prevention of child and adolescent homelessness, or that seeks to address the health impacts that are associated with homelessness. And I think, as much as we, I've talked now about preventing young people from entering homelessness, we also need to remember that, for those who do experience homelessness, it does have very severe impacts. And so we also need to keep those health impacts in mind when we talk about this topic. So I think at this point, I will hand over to Kate to tell us a bit more about policy. And I think you have slides you'd like to share, Kate?
Yes, thank you. I'll just share some slides. Can you see those? Yes?
Kate, we've just got them in your in the main window, not as a slideshow.
Okay. Just remember how to make it slideshow.
That's it.
Go back to the beginning. So sorry. Sorry for that. Hi, everyone. So many thanks to Aracy and to Jess for inviting me to join you. And can I also acknowledge that I'm joining from Wurundjeri country and pay respect to elders past, present and emerging, and acknowledge that these lands were never ceded. So that was fantastic to hear everything that Jess was telling us about research on homelessness and children and young people, because I think what I can sort of see coming out of that is a much more granular understanding of what the drivers of homelessness are, which then gives us a lot more scope for policy change to address those issues. So it's fantastic to think that we will, down the track, have this, much more informed understanding, rather than, I think, what we do know is, the sort of big, the major drivers of homelessness for children and young people, but not that granularity about how changes might sequence over time, or perhaps what the, relatively most important intervention points to support children and young people so they don't become homeless would be. So it's fantastic to see the consortium being formed and those different data points all being brought together, and I look forward to hearing what amazing new knowledge that creates for the policy environment. But what I want to do is sort of springboard off where Jess was talking about the different things that are happening in the policy environment, and give you a bit more of a sense of what some of the current discussions and debates are at the moment, and where child and youth homelessness policy sits within those broader conversations. So there's a couple of big changes that have happened recently, or policy processes that are underway. So the first one that you can see on the picture is that we have a new 5-year National Housing and Homelessness Agreement. This has had different names over time. It used to be called the Commonwealth State Housing Agreement and the Supported Accommodation and Assistance Program, and then it was called the National Affordable Housing Agreement, and then the National Housing and Homelessness Agreement. And now it's basically the same agreement, but it's called the National Agreement on Social Housing and Homelessness. So that is the vehicle through which the federal government funds the states to invest in social housing and homelessness programs. States also contribute other resources to homelessness, along as well as the funds that they receive through from the federal government. But one of the things in that which is worth noting in relation to child and youth homelessness is that young people are not identified as a priority cohort. So the agreement doesn't identify a whole series of priority cohorts, but there was calls for action in the development of that agreement that young people would be identified as a priority, and that didn't happen. And so Jess has also identified the National Housing and Homelessness Plan as a big issue in the policy landscape at the moment, which indeed it is. So we've had consultations around the National Housing and Homelessness Plan in 2023, and through that process of consultations, there was a lot of organisations, including Homelessness Australia, but many, many others, who called for there to be a standalone child and youth homelessness plan that would sit alongside a mainstream housing and homelessness plan. So to explain the context of that, I'll just take a step back and say the reason that government of developing a national housing and homelessness plan is this is something that's been called for, particularly by the homelessness sector, for a great many years, partly because all of the different factors that cause homelessness sit across different areas of government endeavour. So you could see, even through what Jess was sharing before, all of the different factors that contribute to child and youth homelessness across family wellbeing, across housing, across health, all of these different areas. And so to fully address homelessness, you need policy that sits across all of those areas. And so the only way to kind of create or not the only way, but an important way that you can create a strategy that sits across multiple areas is you have one clear objective and then a strategy to achieve that objective. And so that's what the hope and aspiration for a national housing and homelessness plan would be, is that it would identify the different areas that create homelessness and then have action plans to reduce homelessness across each of those areas. And that brings me to why it's important that we would have a special plan for children and young people is for a number of reasons. So I'm going to talk you through. So Jess has touched on this, but compared to adults, there are very particular reasons why, and particularly unaccompanied children and young people become homeless that differ from the reasons that adults become homeless. So it's particularly this context of family dysfunction and domestic and family violence experienced as children within a family home that is one of the biggest drivers of unaccompanied child and youth homelessness. And these issues that children experience around neglect and abandonment, violence, abuse, both create homelessness, but they also, homelessness in many ways is a symptom alongside a lot of other symptoms that Jess was talking to around potentially risk-taking behaviours, suspensions at school. All of these are just really, symptoms or cries for help that mask what's happening underneath, which is these issues that I'm talking about on the screen. And so what we know about children who become homeless having experienced these issues is a significant amount of trauma. And so that is quite likely a much more traumatic experience, not more traumatic pathway into homelessness than many adults whose pathway into homelessness does often tend to be around financial stress, as well, of course, as violence. And so then when another reason that we would want to see the issues for children and young people treated separately is because young people are more vulnerable when they experience homelessness than adults. So young people are particularly at risk of victimisation, and also don't necessarily have access to Centrelink incomes, which means that they may not also have access to just the fundamentals of life, money to cover the cost of food, transport, healthcare, and other issues. So they'll have different pathways into homelessness, experience more vulnerability when they're homeless, and also there's different potential solutions to children's homelessness. And part of the reason for that is because responding to children, as Jess has identified, sits within a different ecosystem of services. So when we think about adults at risk, we think about an adult health system. We think about different supports that adults might receive through income support, housing. But when you think of children who are homeless, they're operating within their touch points with government services and other community services are different. They're engaging with school, at least at some point they're engaging with school. Often by the time they're homeless, they may have disengaged, but at some point they would have been engaging with school. If they're interacting with health services, it's child health services or adolescent health services, so it's a different health ecosystem. And also they're in a family context often, so they're interacting with family services if those are available to get that support. So strengthening those or connecting with children who are at risk of homelessness involves bringing together those different service ecosystems, and that's quite an important piece that gets completely forgotten when we talk about homelessness prevention, because if we focus on the mainstream, we're focusing on how do we better support adults so that they don't become homeless. And another issue which is very particular to children's homelessness, so the issues for children under 18 who become homeless, is this question around guardianship and care. So when we think about adult homelessness, we think about how do we support people to become independent and sustain tenancies. but children under 18 need support with both the practical kind of legal issues that are created when you're not 18, and so you can't sign a tenancy, you can't make decisions around a whole bunch of things you're legally not enabled to, but also at the stage of development they're at, they need someone to be caring and providing the parental guidance and support and care that children developmentally need at that stage. And so in responding to homeless children, we need to be thinking about those guardianship and care issues. And again, without a separate plan, that's something that gets really missed. So those are the reasons that we called for a separate child and youth focused housing and homelessness plan. But unfortunately, despite there was a lot of advocacy from different organisations, when we got to the point where we had the summary of consultations that came back, so government developing a national housing and homelessness plan, they had a whole consultation period. Organisations and individuals were able to put in submissions to that process. And then there was a summary of those consultations, which reflected back what government had heard from those consultations, and they effectively chose not to hear a part of the messages that had been shared with them about the need for that child and youth homelessness focused strategy. So that was a disappointment. But there are some, just before I finish on the plan, we haven't yet seen the plan. So, and we do now have a new housing and homelessness minister. So it's with the new minister who's been in the role now for 2.5 months. It's not yet clear what that change in leadership might translate to in terms of changes in how the plan, what the plan's content will be. So we're yet to see, and at the latest stage, we've been told that plan will come towards the end of this year. But the end of the year is, I think we're all already starting to think how to organise ourselves for Christmas and the summer break. So I think that end of the year is pretty soon upon us. I wouldn't be terribly surprised if that then gets delayed until next year. So I do, though, want to flag that there's a few really great opportunities and moves and progress in the national policy environment around youth homelessness. So just a few days ago, there was the release of the Reconnect program final report, which the Reconnect program is is a federally funded program that does youth homelessness prevention work, working with young people who've been identified with many of the risk factors that Jess mentioned around, disengagement from school, early perhaps experiences of couch surfing or youth homelessness, and other issues in their lives for homelessness prevention. And so Reconnect works often with young people in their family context to try and, as the name says, reconnect them to family or other natural supports so that they don't become homeless. And the review of that program was very positive about the outcomes of the program, and did sort of talk about the need to scale it up. So that gives us some hope that outcome would be achieved, that we can lean into that and hopefully end up with a situation where we have a bigger youth prevention program than we currently have. Because while it's a great program, it's available only in a few locations around the country. So that's not uncommon that we see something that works, but it doesn't get expanded to a whole population. But the other thing is that there's a big national campaign around youth housing called Home Time, and many of people on the webinar are probably already a part of this campaign. But if not, I would really encourage you to be involved. And Home Time has been advocating for the creation of dedicated tenancies for young people. And what this does is recognise two things. Firstly, that young people are not usually ready to live completely independently without some kind of support. And so it recognises that we need to attach support to housing options for young people who can't live safely at home. But it also recognises that the current funding arrangements for youth housing, so new funding that's coming available for housing, like the Housing Australia Future Fund, or even the resources that come through the National Affordable and Social Housing Agreement, don't create housing opportunities for young people because young people's incomes are so low. So community housing providers who might be, or state governments who might be building new social housing opportunities, don't build them for young people or don't provide those tenancies to young people because 25 or 30% of youth allowance is a lot less than 25 or 30% of job seeker payments. So that rent that they will pay is less, and also the amount of Commonwealth rent assistance that they contribute is also much less. So for that reason, and because young people are perceived as being high risk tenants, they end up, even though 15% of people coming to homeless services are young people, that only get about 3% of social housing tenancies. So the campaign seeks to create dedicated youth housing, and it has had some great success. So one of the, back on this slide, is that an existing commitment that the federal government made of $1 billion to something called the National Housing Infrastructure Facility, after a lot of campaigning, has been prioritised as being for young people experiencing homelessness and women and children experiencing domestic and family violence. And of course, many young people are both women and children experiencing domestic and family violence. So those two groups are really, in some ways, there's a lot of overlap. So I think that is an enormous step forward, and will address a major issue in youth homelessness, which is young people coming into experience of homelessness, and if they can't safely return home, not being able to escape homelessness because they can't get into housing with the support they need. So I'm going to leave it there. Thanks again for having me, and I look forward to the discussion.
Thank you, Kate, for an amazing presentation of some of those absolutely practical needs faced by those who have become established. And Jess, thank you for that beautiful and very detailed overview of really looking at prevention pathways. We were meant to finish at 2:45, so I'm afraid rather than take questions, I think my role really is really just to thank you. I think what we've appreciated today is how complicated this field is, the importance of advocacy, the opportunities for researchers and advocates to come together, absolutely the need for more detailed understanding of those trajectories into homelessness. So Jess, I think many of us are very excited to hear of this Australian Homelessness Consortium that you're establishing. Congratulations to ARACI for its efforts indeed in supporting this as well, because I think that whilst we know on one hand that the data of itself, we shouldn't need more data than the numbers of those who are presenting at homelessness services. So on one hand, data of itself doesn't drive change, but this is such a neglected population in terms of research for a whole lot of reasons, as we can all understand. and so needy in terms of what's required. So I think, as you can see from the comments that are coming through, people are very appreciative. And perhaps I'll just ask a simple question from Paul, which is, are the slides going to be available? Because that would be good to be able to know whether they can be shared.
Yes.
So nods all around, so I'm thinking yes. Okay.
Okay. And I believe that the recording will also be available.
Terrific. All right. Well, on behalf of all of us, thank you. And Liz, back to you.
Thank you, everyone. What a very insightful discussion. Thanks for joining us today for what was our final in the 2024 series of the ERACI Longitudinal Studies Collaborative webinar lunchtime series. The next webinar will take place in early 2025, so keep an eye out for promotions in the new year. As we've said, the recording will be made available, and if you're not already, subscribe to the ERACI newsletter for details about when that is available. Thank you, everyone, for joining us. We hope you've found it just as informative as we have, and have a wonderful day.